I have dreamt of this day since I was 12. I knew every nuanced detail from the size of the hall to the number of attendees down to the color of mud. Wait, stop, go back. There is nothing wrong in meeting the man of your dreams as long as it doesn't turn out to be a nightmare for both of you. Hi fam, welcome to Triple F with Dr. OBeLs. I want to say a big thank you to all the women who shared their stories on the first season of my Her Experience series. A lot of young girls and women have benefited tremendously from it. If you'd like to share your stories on the next season coming up in 2021, please send your stories to the email displaying on your screen. Now, several couples have resorted to divorce because of revelations that poured out of the closet after saying I do. Don't get me wrong, love is a beautiful thing and marriage can be priceless, but not when it comes at the expense of your happiness. I know you're excited to get married, but there are certain medical issues you and your partner should probably talk about before tying the knot. This can actually form a strong foundation for both of you to build on. So I'm going to divide it into 3 parts. History, examination, and investigation. Remember, it is a give and take situation, so both of you are trying to find out so that you can share the information amongst yourselves. It's supposed to be forever and always, right? Good. In history, we want to find out if your partner or his family have any chronic illnesses like diabetes, asthma, hypertension, or sickle cell. The presence of mental disorders should also be questioned. The examination part can be done individually. Make sure you do a self-breast examination. I talked about it previously in my video when I discussed the 3 breast surgeries I had. You can find the link up here or in the description box. Investigations and tests and their importance will include blood group. So if you're rhesus D negative, like A negative, B negative, AB negative or O negative, then it's important to know the blood group of your partner. If he is rhesus D positive, then it's important to know that when you get pregnant, an injection is supposed to be administered to you within 72 hours after giving birth. It is called ROGAM, and this is to prevent what we call rhesus isoimmunization, where in your next pregnancy, your body starts to attack your baby, causing multiple miscarriages because it sees it as a foreign body. Genotype. So if you are SS or AS and you plan on giving birth naturally, then it is best to get married to a partner that is AA to avoid risking the birth of a child with sickle cell. Trust me, I have seen several episodes of sickle cell crisis in friends and patients to tell you that it is not worth the risk. STD screening. This involves virology, which tests for HIV, hepatitis C, hepatitis B, and VDRL, which tests for syphilis. It also screens for chlamydia and gonorrhea. While these diseases are treatable and some even curable, it is important to know each other's status so that if it is positive, you can start commencing treatment before a wired transfer is carried out. Remember, these STDs, they show for face. Pap smear. For women who are sexually active, this test will detect abnormal changes in your cervix and will let you know if you should worry about cervical cancer. I made a video about it and also the vaccines that can be used to prevent it. You can also watch the video from the link in the description box. Fertility testing. This is for couples who plan to have children, and the indications for you will include tubal occlusion, or if you don't ovulate, what we call anovulation, or if you have endometriosis. It is not a shocker that some couples don't want to have children, and that is okay too. Remember when I said asking for family history is important? This is where it may also come handy. So depending on what illness an immediate family member have, you can go ahead and do blood pressure to rule out hypertension. You can do fasting blood sugar for diabetes. You can do a breast mammogram if you're at risk of breast cancer. You can do a liver function test if there's a liver disease in the family. You can do a serum electrolyte, urea and creatinine if there's a kidney disease in the family. You can do an ECG and echocardiogram for a heart disease, and you can do genetic testing if there are genetic disorders. You can also do a mental health assessment to rule out mental illnesses. Oh boy, trust me, in this world there are too many problems to go round the universe tries. So let us save ourselves the extra heartache of finding out avoidable secrets after saying till death do us part. You must also not wait to have a partner first before carrying out all these tests, as most of them are actually routine tests that can be done yearly. I know some people are going to say, ha, doctors, people have come again, oh, all these tests is not necessary. After all, our grandparents did not do them, and all of us turned out fine. Well, certainly not everyone did. Moreover, if we want to compare the statistics of chronic and mental illnesses between now and then, the rate has significantly tripled, if not even quadrupled theirs. So go to the hospital and check yourself. After all, sharing this information between you and your partner will also foster trust between both of you. After all is said and done, never forget that change is the only constant thing. And if you say, okay, you want to live your life carelessly because all your results came out to be fine, then it may surprise you that what may never have been traced down to your 17th generation of ancestors may just decide to start from your own lineage. Remember, wedding is just a day, but marriage is for a lifetime. So I'm sure you want to start your marriage and your union in optimal health. So you know you're getting, get wisdom, and I wish you a happy married life. Don't forget to hit the subscribe button and turn on your notification, and I'll see you same time next week Friday.